First, identify the areas of allodynia or hyperalgesia and any painful regions that extend beyond this. Then, clearly mark these on the patient's skin with a suitable skin marker. Treatment should be carried out in a well-ventilated room. Prior to application, the skin area should be gently washed with soap and water and thoroughly dried. The Cutenza patch should be applied to dry, intact skin only. If hair removal is necessary to aid the adhesion of the patch, the hair should be clipped rather than shaved. Trace the skin area to be treated onto a stencil or directly onto the Cutenza patch. Use anatomical markings to ensure the patch is applied to the correct position. Nitrile gloves should be worn at all times before and during administration of Cutenza, as latex gloves do not provide adequate protection. Cutenza is supplied as a single-use, thin 14 by 20 cm transparent adhesive patch that can be cut to match the size and shape of the skin area to be treated. A maximum of 4 Cutenza patches may be used per treatment. The adhesive side is covered with a removable, clear, unprinted, diagonally cut release liner. Cut Cutenza before the release liner is removed, and do not remove the release liner until just before application. The diagonal cut in the release liner is designed to aid its removal. Peel and fold a section of the release liner and place the adhesive side of the Cutenza patch onto the treatment area. Hold the patch in place, then slowly and carefully peel away the release liner while simultaneously smoothing the patch onto the skin with the other hand. Make sure there is complete contact between Cutenza and the skin with no air bubbles. Adhesion can be aided by applying pressure to the patch during application using gauze or bandages to tightly wrap the treatment area. Other methods include having the patient wear socks or asking them to lie on the treatment area. Allow the patch to remain in place for 30 minutes on the feet or 60 minutes for any other area. If the patient develops a burning sensation in the eyes, skin or airway, remove the patient from the vicinity of the treatment area and flush eyes or mucous membranes with water. After the specified application time, slowly and gently remove the Cutenza patch by rolling it inwards to minimize the risk of aerosolization of capsaicin. As before, be sure to always wear nitrile gloves while handling the patch or any other materials that come into contact with the treatment area. Both used and unused patches, as well as any other materials that have been in contact with the treated area, should be sealed in a polyethylene medical waste bag and placed in an appropriate medical waste container. Put on a new pair of gloves and apply cleansing gel liberally to the treatment area and leave on for at least 1 minute before wiping the area with dry gauze. The area should then be washed gently with soap and water. Take care when using the cleansing gel to avoid irritation of the eyes and mucous membranes. Advise the patient that redness or burning may occur at the site of treatment for up to a week, but that these symptoms should resolve over time. The treated area may also be sensitive to particular activities for a few days, such as heat, hot showers or baths, direct sunlight, or vigorous exercise. Cooling measures or oral analgesics can be used to manage any discomfort. Use chilled, not frozen, cool packs on the treated area after the Cutenza application, wrapping the cool packs in material to avoid direct contact with the skin.